guys, welcome back again for another video. So for today's video is we're going to return demonstration bed batting on the adult patient. So for today, papaliguan po natin yung ating patient, and unang-una po natin gagawin is kailangan po natin siyang i-assess. So i-assess po natin yung kanyang condition po ng skin niya. Assess po natin yung, so the client's skin is soft and then good in turgor, and then the color is fair, and then kailangan din po natin i-assess yung kanyang physical and emotional factors. Kailangan po natin i-assess kung meron po siyang nararamdaman, if there is any presence of pain. Sir, may sakit po ba sa inyo? Nahihilo po ba kayo? Okay lang po ba kayo? Then we need to assess the client's range of motion of the joints. Sir, nagagalaw niyo po ba yung mga kamay niyo? Yung kabila po, nagagalaw niyo po? Okay po. Then, next is we're going to assess if there is any other health problems that may break the batting process. And also, we're going to assess if there is a need for clean gloves in the batting process. Assess lang po natin kayo, yung skin niyo po, condition niyo po. Sir, nagagalaw niyo po yung... Okay. Nahihilo po ba kayo? Hindi naman po. At okay lang po kayo? Nilalamig po ba kayo? Okay. So, before we start on the bath process, we're going first to determine the type of the client that the client wants. So, the bath is we're going to do to the client is a complete bed bath. We are also determine the self-care ability of the client, kung nakakapag-participate po ba siya sa akin ng maayos at kung nagagawa niya po yung procedure. Next is we're going to determine the any position or movement that precautions to the client. Going also determine if there is other care that is receiving the client. Next is we're going to determine the client's comfort level with being back with someone else, and also we need to determine if kakailanganin po natin ng clean gloves sa pagliligo sa kanya. Lastly is we need to determine the necessary equipment and linens that we are going to use in this bathing process.
The equipments are basin with warm water for washing and for rinsing, soap and soap dish. The linens are bath blanket, 2 bath towels, washcloth, and then clean gown. Gloves, personal hygiene equipment such as lotion, deodorant, and table for equipment and laundry bag.
For first procedure is we need to introduce ourselves, identify the client's identity, and then explain what you're going to do and why it's necessary, and then also explain the client how he can participate in this bathing session. So, hello po, good morning po. My name po is Charlotte Wenabi Bustamante, your student nurse for today. Hello po sir, ano pong pangalan po nila? Oh, Sir Charlton, ang gagawin ko po ngayon sa inyo is papaliguan ko po kayo sa bed. Ang maganda po natin na ginagawa to kada morning is para tanggal po natin yung mga microorganism or yung mga dead skins na nasa katawan nyo. And also, para rin po komportable po kayo and matanggal po natin yung mga body odor ninyo. Ginagawa po natin to para syempre po, mag-provide po sa inyo ng relaxation. Next is we're going to perform hand hygiene with the using of alcohol. Next is we're going to provide the client's privacy by closing the windows. Then, close the door because personal hygiene is a personal matter. So first is we need to provide the client, and then the environment. So, invite a family member or significant other that can participate in this bathing process if it is requested by our client. Sir, kailangan niyo po ba ng family members niyo po para tulungan po kayo sa bathing? Ako na lang po yung magbabat sa inyo. Okay lang po ba? Okay po. So, next is we're going to close all the windows, the doors, to ensure the privacy of our client, and then also to ensure the room temperature or comfortable room temperature for our client, because air current increase the loss of heat from the body by convection. Next is we're going to offer the client a bedpan or urinal, or ask whether the client wishes to go to the bathroom or commode, because warm water and activity can stimulate the need to void of the patient. So, it is better po, or it is comfortable po for the patient to umihi po muna sila bago po mag-proceed sa bathing process. Sir, naiihi po ba kayo? Gusto niyo po ba nang pumunta muna sa CR? Hindi naman po. Okay naman po kayo. Okay po. The next is, we need to encourage our client as much as self-care as possible to promote their independence, their exercise, and also their self-esteem. Sir, hello po. Ini-encourage ko po kayo na lagi po tayong maliligo, lagi po tayong magtutoothbrush, lagi po tayong magkikare sa ating mga nails, sa ating ears, sa ating hair. Kasi po, mas maganda na po na malinis po tayo sa katawan natin, para na rin po mabango tayo. Sa pagliligo po araw-araw ay nakakatulong po sa katawan po natin. Matanggal po yung mga bacteria and microorganisms po na nasa katawan po natin. So, ini-encourage ko po kayo na maligo po araw-araw, at huwag po natin kakalimutan linisin yung mga private area po natin, yung ating kilikili na nagkukos po ng sweating at nagkukos po ng pamamaho po ng katawan po natin. And then, ini-encourage ko rin po kayo na linisin po natin yung ating tenga, yung ating bibig or yung ating mouth. Kailangan po natin mag-toothbrush araw-araw. Hindi kakalimutan yung pag-care po natin sa hair po natin. Okay po ba yun, sir? Okay po. Is we're going to apply clean gloves. We put our clean gloves. Now is we're going to proceed on the next procedure is prepare the bed and then position the client appropriately. So first is we need to position our bed in a comfortable working height. Next is we're going to lower the side rails near you, and then keep the side rails on the side of the bed up. Assist the client to move near you. This prevents of undue or reaching or straining, and also it can promote the body mechanics of the nurse. And also it is ensure the client's safety. Sir, move lang po kayo. Move po kayo dito. Relax. For the next is we need to place our bath blanket over the top sheet. Then ask the client to hold the top edge of the bath blanket. Sir, pahawak po. Then, from the shoulder of the client, withdraw the top sheet. If this linen is we're going to reuse, you can put it on the bedside chair. If it is going to change, is we are going to put it on the portable hamper, not on the floor. Portable hamper. So, the bath blanket can provide the client's warmth, comfort, and also the privacy. The next is we're going to remove the client's gown while covered with bath blanket and place the client's gown on the portable hamper. Sir, bari lang po natin yung gown. Then we're going to place it on a portable hamper. Next is we're going to make a bath mitt with the washcloth. So this is our washcloth. And we are going to perform on how to do the bath mitt in a rectangular method. So place your hand on the center and then fold the left side and then the right side. Then you are going to tuck in inside. So the thumb should be exposed. Making a bath mitt can retain heat and water better than the cloth which is loosely held, and also it can be prevent the dragging the washcloth to the client's skin. And now we're going to proceed on the client's face, which is the cleanest area downward toward the client's feet. So next is we're going to place a bath towel on the head of our client. And then wash our washcloth. We're going to bath mitt the washcloth. Then we're going to see the client's face first. As on the eyes is we need to use a separate corner. Sir, magpo-proceed po tayo ngayon sa ating face, sa eyes niyo po. Then i-wash ko po with the different corners or different side ng ating bath mitt. From inner canthus po to outer canthus para ma-prevent po yung pag-enter ng secretion sa nasa lacrimal. Then we're going to
Dry them well.
Then, as the patient, if we are going to use soap in the face of our client, sir, gusto niyo po ba lagyan ko po ng soap yung mukha niyo po? Hindi po. Okay na po yung water only lang. Okay po. Then, we are going to wash the cloth. So, the client said, ayaw niya pong lagyan ng soap yung kanyang mukha. So, ang gagamit po tayo ng water only. Sir, magsa-start po tayo sa noo. Sa noo po, S method po yung gagamitin natin. Noo. Then, papunta po sa ilong. Then, papunta po sa baba. Then, ganun din po sa kabila. Noo po. Then, dito po sa pisngi. Papuntang ilong. Then, pababa po. Then, tsaka po natin siya papatuyuin. Katapos po niyan, sir, magsa-start po tayo sa next is we're going to wash the client's neck and ears. So, mag-start po tayo sa neck, then sa likod po ng ears, then sa loob ng ears, then yung ibang corner, ibang side naman po, yung likod po, then tsaka po natin siya i-wash. Tsaka po po natin i-dry. Okay lang po kay sir? Let's turnawan po natin. And after that is we're going to remove the bath towel on the client's head. Sir, remove ko lang po. And next is we're going to change the water. After obtaining fresh warm water, is now we are going to proceed on the client's
Arms and hands. Place the bath towel.
partes. In lengthwise. Then put down. Then after that is we need to wash, rinse, and dry the client's arm. So we need a washcloth and we need to bath it again. Then we're going to put some soap on the bath mitt. Then we are going to elevate the client's arm. So in washing the client's arm is we need from the wrist to the shoulder and to the axillary. Then we are using a long firm stroke. Then huwag po natin kakalimutan yung kilikili niya. Okay. Then we use another washcloth for the rinsing. Then again from the wrist of our client. Then to the axillary. Then we need to dry them well. Next is we're going to wash the client's hands. We're going to place the basin. And then ask the client, sir, dugdugi po yung kamay nyo. Then we are going to bath mitt and wash the client's hands. We're going to wash between the spaces. Okay lang po kayo, sir. Hindi naman po malamig yung tubig. Okay. Then after that is we need to dry them. The next is we're going to apply deodorant or powder if desired. So we are going to ask our client. Sir, gusto niyo po ba lagyan ko na po kayo ng powder or mamaya na po? Ngayon na po. Gusto niyo po ngayon na. Okay. We're going to use a powder deodorant. Sir, pataas lang po. Then, we're going to proceed on the other side of the client's arms and hands. So we remove the towel. We are going to reverse the bath towel. Again, we place it at lengthwise. Then again, we need to bath mitt or washcloth and apply some soap. Then again, from the wrist or from the distal to proximal, from the wrist to the shoulder, including the axillary. So This promotes the circulation of venous blood flow. And the axillary, and then we are going to rinse it with another washcloth. And then dry them well. We're going to wash the hands of our client. Again, we are going to bat with the washcloth. Wash the interspaces or the spaces between the client's fingers. And then dry the hands. Going to put the powder. Okay.
And then remove the bath towel under the client's arm.